everybody. This is Dr. Sanders here again at Integrated Health Solutions with another tip of the week. Anyone out there ever experienced back of the leg pain or upper calf pain or pain right kind of like where you sit down on your tailbone and off to the side a little bit, and ever wonder where that's coming from, or may have thought that it may have a calf problem or a glute hip problem, or may even think I have sciatica? Well, sometimes those pain patterns can be coming from the hamstring muscles. The hamstring muscles tighten up. They can kind of put compression on the sciatic nerve, so you can feel a sciatic nerve referral pain going down the back of the leg, and sometimes mistake it for maybe I have a slipped disc. A lot of common problems happen with the hamstring when we're dealing with a lot of walking or going from quick to fast or slow to fast motions and not being used to it and not being warmed up, particularly deciding to play 3 hours of soccer over the weekend and you haven't played it a long time. Puts the hamstring prone to injury. Also, having a hamstring tension can be developed when sitting for long periods of time or at a job that requires sitting for 8 hours a day, and so on and so forth. Let me give you a couple of tips and things you could do that can help work on tight hamstrings and minimize the buildup of tension there so that you can enjoy walking and exercising and running and doing the things you love. First tip I want to go over is actual sitting. A fair amount of us, majority of us, actually find ourselves doing a fair amount of sitting on a daily basis. If I'm sitting with a deep-seated chair, especially if my legs are up, my knees are kind of bent, my hips are flexed forward, that creates tension in the hamstring, especially where the hamstrings meet up to the glute muscle. Simply by putting your feet down flat on the ground, and if you have the opportunity or a chair that allows you to increase the height, that increased angle at the knee and at the hip here can actually help create less tension on the hamstring muscles themselves. It also helps reduce tension on other muscles as well. Either if you can't put your feet flat on the ground, you can potentially find a step stool that will help elevate those feet as well to help you maintain this position. There are many different types of hamstring stretches that you can do. Standing, bending forward, touching toes, putting your leg up on a wall, and bringing your hips and body closer to the wall to help stretch those hamstrings out. There's many ways to do it. I like the process of actually massage plus stretching. Sometimes when we stretch, the muscles or part of the muscle that is the tightest doesn't get stretched first. The first part that gets stretched is the parts that are already loose, and they're going to stretch until they can't stretch anymore, and then the tight parts of the muscles will then get stretched, and usually that requires a stretch for many minutes. So what we can do is simply put pressure on the area we want stretched and then do the stretch. So for example, put your leg up here, and you can be sitting on a chair or on a table or anywhere like that. And the hamstrings, there's two parts. There's a middle part going towards the inside of your leg, and then there's an outside part. And you simply just find a tight area, apply pressure on it, and then extend the leg out and back. And then you find another spot. Push in, hold it there, extend it out. You'll feel that stretch right there, and then come back. You systematically work up your leg. Sometimes it helps to be on a flat surface. You can slide the leg along the surface so you don't have to hold your leg up, but that's the motion. You work the inside and the outside, spending about 30 seconds working that both legs is a really good way to target the specific tight areas of the hamstring that need the attention rather than just trying to stretch the whole muscle. Now, if you're having active symptoms and you do the stretch with the pressure, give it about a week of doing that. You'll start to notice the tension and the pain in those areas decrease. If you don't start to notice the pain decrease in that time, there could be some compounding or compensations going on in the pelvis, even in the foot, or it could actually be like lower leg tension as well that's contributing to it, that may need to be addressed by a professional. And we here at Integrated Health Solutions specialize not only in providing relief, but revealing the cause of the problem. And with that cause, we can empower our patients on what they can do at home to help manage their symptoms quickly with quick recovery and help them maintain it in the long run. So if you find yourself with this type of pain, back of the leg pain, back of the knee pain, and have been struggling trying to stretch out that hamstring and having no relief, give us a call. Come in, get evaluated. We can provide some treatments and techniques that can get you a relief quickly and also help you maintain your relief in the long run. Also, please check out our other videos with other tips of things that you can do to help other areas of pain so you can get back to your quality of life that you deserve. And have a great day.